So, the extrusion force is not that difficult. You see the product is coming out, okay?
Are you going to go a little bit up?
Sorry?
Would you go up for the bitemporal area?
Not on her, because you see she has this, she has a big face. If I inject more here, she will have a bigger face. I don't want that. What I want to correct is really under the eyes. So the bolus technique is, you start here, ça va? Okay, so now I'm là, just a low anesthesia. You look at the graduation. Ça fait mal ou pas?
Non, ça va.
Vous sentez quelque chose? Okay. So I inject here slowly. And here always deep. You see it's a bit resistance, but I already injected half a cc, which is a lot. Okay. Then I can move forward a little bit there at the end of the needle. So I'm here, always deep. I make an angle 45 degrees from the skin. Ça fait mal là? Ça va? Okay. So this is half a cc of the lumen. Clean again. So I like to clean every time I inject. I like to clean. Ça va? This is because of the local anesthesia. This nerve is working, this one not. Okay, relax. So 45 degrees from the angle of the face. You don't see it from here. So this is a simple technique. It's not the one that I prefer, because you have to make multi-point of injection. Okay. So you can also move a little bit, okay, like this. And what I'm looking for is I inject under the orbicularis here, so you can change and come here, to elevate the orbicularis with the product, to treat a bit of the teardrop. Okay? You see I don't come out with my needle, I just stay under the skin, and sometimes I have to use my 2 fingers because I want to, my 2 hands, sometimes the extrusion force is a little bit strong, okay? And I have like one gloves with oxygenated hydrogen peroxide and some cold ice pack. Okay. So what we can see is this is, you see it's more round here, okay, and here it's flat. Okay. So you have this convexity. Smile. Souriez. Okay. And even if I didn't inject laterally, I have an effect. You see here? Stop. And on the profile, tournez-moi complètement. You see, I shorten the lower eyelid. This is more convex. Tournez, 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 tournez. Voilà. And this is really flat. You see? Okay. And this is only one cc. It is ça. An ice pack. Vous pouvez tenir ça comme ça. C'est tout. Ok. Ici au milieu. I need the garbage. Right here. Oops. Dangerous. Okay, on the other side. So this was a bolus technique. You can also use the technique that I don't like so much. Sorry. The bolus technique is really perpendicular, like this. Je fais pas ça. Like this. But this is very aggressive because you go on the periosteum, then you make a bolus, and then you have to do a strong massage and not like this technique.
You do the tunneling now?
Now I do the tunneling, okay? So I did my injection here. You see the length of the needle? It's not that long, but it's enough to go here. Ça va? Now I push the piston, okay, and I go forward, parallel to the orbital rim and tangential to the bone. And with one injection point, I can do all the midface here, central midface. Regardez en haut. The good trick is to ask the patient to look up. Regardez en bas. En bas, en bas, en bas, en bas. You see it? You don't see the orbital rim. Regardez en haut. You see better the orbital rim here. And I was telling you before, when you talk, the needle is there, so you have to be very careful when you do live injection. And now I am injecting always, you see the piston is going there. It's anterograde and retrograde technique. It's not both. Okay? Like this. Yes?
She has a deep orbital rim. Then what will be? And we will inject this bone. You would feel that the eyes are.
So what I'm doing, I'm not only injecting here on the fat, I'm injecting also here under the orbicularis to feel a bit this orbita, but under the orbicularis. Then, on her, Julian 2 on the top, but I think with the volumizing effect of this product, I think it's enough to on the one stage, and then on the second stage I will use the Augmenter tool. That's it. The problem is I was using the 21 gauge at the beginning. It's very, very good to inject. The 23 sometimes you have to inject with your 2 fingers, your 2 hands, and that's the problem. But on the second case and the third case I will show you differently with different approach. Ça fait mal un peu là? Okay. Regardez la caméra. Voilà. Un petit peu la tête en haut. Voilà. Okay. We don't have also the same light. So sometimes it's a little bit different. So in that case, I can also inject there and finish. This is the bolus technique. You see I'm perpendicular, and I project lateral part and the upper part of the mirror area. Like this. Okay? On peut jeter. What I recommend, I invite you to look at the patient afterwards, not only on the screen, but really on her, because when you look up, really in 3 dimensions is better. Okay? So again, you see the convexity here. Okay. Of course, we can inject the Julian too, but not on this. In this case, she wants just a few. She wants just a natural. Allez-y, appuyez. Result for now, and in a month, she can have an injection under the ICM. So this is the first step. With Voluma, with a 1 cc per side, 1 syringe. Okay. No. Okay. Souriez. Okay, relax. So then I can use the time. This is because you know you have a swelling effect, and then in some days you have a water absorption by the product. So never overcorrect the area, because if you inject too much, then you have 20% more of volume with Voluma. It's okay. It's not a strong massage, it's just a molding, and you can see that this is the product. You see the product is there, right there. Okay. C'est bien ce que vous voyez, le résultat. Dans l'écran, il est derrière.